Hi everyone, and welcome back to Diary of a Kidney Patient. If you're new here, my name is Joe. I've been living with chronic kidney disease for over 10 years, and I'm currently on peritoneal dialysis here in the UK. On this channel, I share my real-life experiences to help others who are living with kidney disease, preparing for dialysis, or supporting someone who is. Today's video is one that I've wanted to make for a long time because it's something that isn't always explained very well. When you're diagnosed with stage 5 kidney disease or you begin dialysis, there is so much information to take in. You're learning about treatments, medications, appointments, diet, and suddenly your whole routine changes. What many people don't realize is that there may also be financial help and practical support available. The problem is that finding the information isn't always straightforward. When I first started looking into it, I found it confusing. Different websites said different things, there were benefits I'd never heard of, and I wasn't sure what I could apply for or whether I would even qualify. So today I want to explain the difference between means-tested support and non-means-tested support, and hopefully make it a little easier to understand. Before I start, I just want to say that this video is based on my own experience and research. I'm not a financial advisor, and benefit rules do change, so always check the latest information with the relevant organizations before making an application. Let's start with something that confused me at the beginning. What's the difference between means-tested and non-means-tested support? A means-tested benefit looks at your financial situation. That means your income, your savings, and sometimes the income of the people you live with. If your financial circumstances are above certain limits, you may not qualify. Examples of means-tested support can include universal credit, council tax reduction, housing support where applicable, and help through the NHS low-income scheme. Whether you receive these depends on your individual circumstances, so two people receiving the same dialysis treatment could receive completely different levels of support. Then there are non-means-tested benefits. These are different because they are generally based on how your health condition affects your daily life, rather than how much money you earn. One of the best-known examples is Personal Independence Payment, or PIP. One of the biggest misunderstandings about PIP is that people think it's only for wheelchair users or people who can't walk. That isn't how it's assessed. The assessment looks at how your health condition affects everyday activities, such as preparing food, washing, dressing, managing medication, communicating, planning journeys, and getting around. It's about the impact your condition has on your daily life, not simply the name of your medical condition. Another thing people often assume is that being on dialysis automatically means they'll receive benefits. Unfortunately, that's not how it works. Having chronic kidney disease or being on dialysis does not automatically qualify you for financial support. Every application is assessed individually, and the decision is based on how your condition affects you personally. That's why it's important to explain your day-to-day challenges clearly when completing any application. If you're over state pension age, there may also be attendance allowance depending on your circumstances. If you're still working, it's also worth looking into access to work. Access to work isn't a benefit in the traditional sense. Instead, it can provide practical support to help disabled people stay in employment, and it's something many people don't realize exists. One piece of advice I definitely give is don't make assumptions. Don't assume you won't qualify, but equally don't assume you automatically will. Ask the question. Speak to your renal social worker if your hospital has one. Talk to Citizens Advice. Speak to your dialysis nurses. Many renal units have access to welfare advisors who understand kidney disease and can point you in the right direction. There are also organizations like Kidney Care UK and Auriga that provide information about benefits, grants, and other support available to kidney patients. Sometimes just having someone explain the process makes a huge difference. The important thing is not to struggle in silence. If you think you might be entitled to support, it's always worth checking. The worst that can happen is you're told you're not eligible, but if you don't ask, you could miss out on help that would genuinely make life a little easier. In my next video, I'm going to move away from financial benefits and talk about all the practical support that many dialysis patients don't know exists. We'll look at things like blue badges, disabled persons rail cards, hospital travel costs, priority services registers, Watersure, Kidney Care UK grants, airport assistance when travelling, and several other schemes that can make everyday life that bit easier. Some of these aren't financial payments at all, but they can save money, reduce stress, and make living with dialysis much more manageable. If you found today's video helpful, I'd really appreciate it if you could give it a like and consider subscribing. My aim with this channel has always been simple: to share honest experiences, practical advice, and the information I wish someone had given me when I started this journey. Thank you so much for watching. Take care of yourselves, remember Jesus loves you and so do I. I'll see you in the next video.